Hi, good afternoon, everyone, or good evening from wherever you're joining us today. My name is Evangeline, and I will be hosting today's webinar. Welcome to the CSE's Development in Action webinar. Today's topic will be exploring the challenges and solutions to epilepsy care in resource-limited settings in Cameroon. And today we have with us Mundih Njohjam, who will be delivering this webinar today and will be presenting on her work in leading and advancing epilepsy care in Cameroon. Uh, a brief introduction to Mundih. Mundih is a medical doctor and a trainee neurologist currently based in Senegal. She is passionate about improving access to neurological care and promoting brain health in resource-limited settings such as Cameroon and other areas. And her main focus is promoting healthcare in rural communities. When not seeing patients, she is championing several community-based programs for neurological and cardiovascular disorders. I'm pleased to inform that Mundih is a 2021 Commonwealth Distance Learning Scholar from Cameroon. She completed her MSc in Global Health at Liverpool School of Tropical Medicine. And in today's webinar, she will discuss her work in promoting epilepsy, but she will also talk about her experiences as a distance learning scholar in pursuing her studies while also working within the health sector in Cameroon. So Mundih, over to you.
Thank you so much, Evangeline, for the introduction. Hi, everyone. As Evangeline said, my name is Mundih Njohjam. I'm a trainee neurologist from Cameroon, but I'm based in Senegal for my training. Okay, so I want to start by thanking the Commonwealth Scholarship Development in Action for the opportunity to share the work that we've been doing in Cameroon to reduce the burden of epilepsy. So this is going to be an outline of the presentation today. Next slide, please. So I'll start briefly describing epilepsy. For those who are not of the medical field, epilepsy is a chronic brain disorder which is characterized by an enduring tendency to have recurrent seizures. It is a condition that is commonly known in many African settings as a fainty fit, and it is one of the most stigmatized conditions. In fact, for many people with epilepsy, living the social consequences of epilepsy, such as stigma, is actually more difficult to deal with than the seizures themselves. So epilepsy is a brain disorder, like I said. Our brain is like the control center of our body. It is thanks to our brain that we are able to reason, we are able to talk, we are able to behave normally, and we are able to interact with people. And the brain is made up of cells called neurons, and these cells enable the brain to carry out its function. And these cells communicate with each other by releasing what we know as nerve impulses. These are actually electrical messages. So in a normal person, someone who doesn't have epilepsy, this communication is controlled to ensure that there is some sort of order going on. But in the brain of somebody who has epilepsy, there is an abnormal communication between these cells. This communication becomes random and hyper excessive, leading to the different manifestations that we see in people who have epilepsy. Next slide, please. So in Cameroon, Cameroon has one of the highest epilepsy prevalence in sub-Saharan Africa, as you can see from the image. This is compounded by low access to epilepsy care, low public awareness of epilepsy, which often results in several myths and misconceptions, which often leads to stigma, discrimination, and marginalization of those affected. And additionally, epilepsy is under-researched and underfunded, and it is considered as a low priority when it comes to government funding and even a government initiative. Next slide, please. So there are several challenges to epilepsy care in Cameroon. I've mentioned stigma. Because of stigma, there are many people who have epilepsy, who live with epilepsy in hiding because they are afraid of how people will treat them. They don't go to the hospital to seek care. We also have myths and misconceptions. There are people who believe that epilepsy is due to bewitchment or due to the fact that somebody is under a generational curse or the person is possessed by a demon. And because of this, the first resort to care is always traditional healers. Patients prefer to go to traditional healers to seek care. And it's only when they don't find a solution to the problem that they decide to come to the hospital. And very often it's already late when they come to the hospital and we just have to manage the complications. We also have shortages of essential medications. It is estimated that about 70% of persons with epilepsy can become seizure-free if they are placed on anti-seizure medication. But regrettably, in most African countries like Cameroon, access to anti-seizure medications is very low. And we also have a critical shortages of specialists, especially in the rural area. In Cameroon, currently, we don't have any epilepsy specialists in the rural area. Meanwhile, more than 80% of those who are affected are actually residing in the rural area. As I mentioned before, there is a low level of public awareness of epilepsy, which often leads to a delay in seeking care in medical facilities. Next slide, please. So based on all these observations, we decided to start this nonprofit organization in 2020. So how did we really come to start this organization? In 2019, I worked on epilepsy in rural communities for my MD thesis. And one of the things I really observed was the high burden of epilepsy in these communities, but yet there were no specialists to help the patients. The level of public awareness was very low. There were several myths and misconceptions. There were extreme levels of stigma against those affected. So this motivated me to start up this nonprofit organization in 2020 after graduating from medical school, with the aim of supporting epilepsy care in Cameroon. We are aiming to provide holistic care because, just as I've said, managing epilepsy is not just about managing the seizures. Most importantly, it's about managing the social consequences, which are often more problematic to many patients than the seizures themselves. And we are using a multi-strategic approach to achieve this goal. Next slide, please. So what are some of the strategies and activities that we are using to achieve this goal? We organize awareness raising activities in schools, churches, local markets. We conduct door-to-door as well as street sensitization, where we talk to people on the street about epilepsy. We distribute educative flyers and resources to people to enable them learn more about epilepsy so that they can encourage people who are affected to come to the hospital and also treat those people with respect and kindness. We also organize awareness raising activities on social media. We organize workshops and seminars for both people with epilepsy and those without epilepsy. We work with local and national media outlets to ensure that we have a maximum reach when we go out for sensitization. Next slide, please. So this is one of our volunteers on the street educating passerby about epilepsy. Next slide, please. So another strategy we are using is designing and implementing epilepsy clinic in both rural and urban communities. Like I mentioned, many people with epilepsy are not able to have access to epilepsy services because in many communities, these services do not actually exist. So what we do is we partner with local hospitals and we design and we implement epilepsy clinics where people with epilepsy can actually come and receive medications, health education, and follow up their epilepsy. So the picture here is one of the it's just a cross-section of some of the patients that we have in one of our clinics in a rural community in the West region of Cameroon. Next slide, please. And we also organize mobile clinics to rural communities. So we partner with local healthcare providers, and we organize mobile health clinics where we go into remote communities. We provide healthcare services. We raise awareness about epilepsy among the local population so as to encourage early presentation to the hospital. Next slide, please. We are also engaging in healthcare worker training. One of the main challenges in the management of epilepsy is the critical shortage of healthcare workers who have been trained in epilepsy management. To address this gap, we organize capacity building activities for rural and both urban and rural healthcare workers, where we train them on basic diagnosis and management of epilepsy. We also train them on how to counsel patients, because many a times these patients, they don't adhere to their treatment. They come to the hospital, you see them, you prescribe treatment, they go back home, they stop taking the treatment, they go to native doctors, and when they come back, their situation is worse. So we also train healthcare workers on how to counsel these patients. And we are focused mostly on rural healthcare workers for the reasons I cited before. There is a critical shortage of these healthcare workers in the rural communities. Next slide, please. And we are also engaging young people. Our organization is a volunteer-based organization. So volunteers are actually the lifeblood of our organization. So we organize capacity building activities for young people. We train and empower them as young advocates and peer educators. So they go into their communities, they educate people about epilepsy, they refer cases that they encounter in their community to the hospital or to our organization, and we try to link these patients to local healthcare facilities. Next slide, please. And we are also working to encourage students with epilepsy, because one of the consequences of epilepsy is early drop out of school. There are many studies that have been done across different countries in Africa, reporting a high early drop out of school by children or students who have epilepsy. So we organize like backpack giveaway, where we give didactic materials to students with epilepsy to encourage them to continue with their education. We also organize capacity building activities for women with epilepsy, because in addition to the challenges that are faced by all persons with epilepsy, women with epilepsy face gender-specific challenges, which further reduces the quality of life. For example, it has been shown that women with epilepsy are less likely to get married, less likely to complete their education, less likely to have access to educational as well as employment opportunities. They are often victims of sexual abuse. So we organize these capacity building activities for these women. We teach them how to live well with epilepsy. We teach them how to live well with epilepsy as a woman who has epilepsy. We also empower them so that they can be able to overcome those, especially social consequences of epilepsy, such as stigma. And we also offer them support, those who have been victims of maybe rape, sexual abuse. We offer them support. We try to link them to local resources where they can get help. Next slide, please. So we are also raising awareness on social media, and the pictures here are just showing some of the impact that we've had on social media. Like, for example, one of the posts that we created a post and then we promoted it, and we're able to reach over 200,000 people from across different African countries. We also organize like 1 month online campaign where we create educative flyers. We share them on different social media platforms. And during one of those campaigns, we're able to reach over 1 million accounts on different social media platforms. Next slide, please. So what has been the impact of the work that we've been doing? The impact has been multifold. We have observed a significant improvement in the quality of life and self-esteem of people with epilepsy. We've trained and empowered young people who are really driving change in their community when it comes to epilepsy awareness. At the level of the community, we've seen an increase in the level of awareness and a reduced level of stigma. So the picture here is actually one of the testimonies that one of our volunteers shared with me, where a friend of hers who used to persecute her because she was volunteering with us, telling her that epilepsy is caused by witchcraft, that she should not join or associate with us. So that friend of hers actually came across a case of epilepsy, and she was forced to act because she has been like seeing all the messages that her friend has been sharing on epilepsy, or how to respond to somebody who has epilepsy. So from using what she learned from seeing the messages on her friend's statue, she was able to support that person with epilepsy in a car. And since that day, she changed her perspective of epilepsy, and she has now become a volunteer and is actively raising awareness in her community. Next slide, please. Next slide, please.
Mundih, it is on the next slide. I'm not sure if you can see. It's on the UN Sustainable Development Goals slide.
Yes, I can see the slide.
Do you want me to go to the next slide?
No, I have to comment on this first.
Okay.
So the work we've been doing has been contributing significantly to the achievement of sustainable development goals in our communities as well as Cameroon. Through our work, we've contributed to improving health outcomes for people with epilepsy in line with SDG 3. We've also contributed to reducing discrimination faced by people with epilepsy in education and promoting inclusive and safe school for people with epilepsy in line with SDG 4. And we've also contributed to the reduction of discrimination and violence against women with epilepsy in line with SDG 5. Next slide, please. So we started with epilepsy, and in the course of our activities, we realized that the challenges that is going on with epilepsy is the same for many neurological disorders in Cameroon, like headache, stroke, dementia, and Parkinson's disease. So we decided to scale up our work to include other neurological diseases as well as brain health. So currently we are raising awareness or implementing similar activities for other neurological disorders in Cameroon. Next slide, please. So a quick word on my Commonwealth Distance Learning Scholarship experience. So I got the Commonwealth Distance Learning Scholarship in 2021 when I was working as a general practitioner. And I didn't really want to travel because I wanted to continue with my activities as well as my clinical work. And when I got the Commonwealth Scholarship, it really aligned perfectly with all my plans. And I got the scholarship to study a master's in global health at Liverpool School of Tropical Medicine. And the knowledge and skills that I learned from this master's has really been instrumental in all the activities that we've been carrying out in Cameroon. I acquired first-hand knowledge on global health skills and competencies, which I've been applying locally to implement projects, even while training as a neurologist. And additionally, I've been volunteering with a primary healthcare program in Cameroon, where I design and I implement projects, healthcare projects, and also support community health workers as well as rural primary healthcare workers in managing other conditions in rural communities. So I'm really grateful to the Commonwealth Scholarship for the opportunity to really do the Masters in Global Health. Next slide, please. So I would like to end by thanking and acknowledging the amazing volunteers with whom I've been working. They have been the backbone behind every activity that you've seen. They have been selfless and they've really dedicated their time to raise awareness, to destigmatize epilepsy and ensure that people with epilepsy are accepted and supported in our community. And I also like to thank the Commonwealth Scholarship for the opportunity to do the master's in global health, which has really been instrumental in the work that we've been doing and the work that we'll continue to do in Cameroon. Thank you very much for your attention.
Thank you so much, Mundi. That was a brilliant presentation. Thank you so much for discussing your work in championing epilepsy care and also raising awareness within local communities. I think on behalf of the audience, it was inspiring to hear about your work in raising awareness, but also leading a team of volunteers to carry out community work and to carry out work within the remote communities and training healthcare professionals as well through your organization. So thank you so much for presenting on your work. Um, we would now like to begin with the Q&A sessions, but so please feel free to send in your questions in the chat box. By following the questions, we will also open the floor to discussions. So please do send in any comments in the chat box. If you have experience of working in advancing epilepsy care in your home country, or if you have any similar experiences, please feel free to share them in the chat box. And of course, we would, if you are comfortable, we can also ask you to unmute yourself and discuss your experiences with the wider audience today. I will begin with the few questions that we have received in the registration form. So thank you to all those who have shared questions via the registration forms. Mundi, if you are happy to begin with the questions, I can start with the first question.
Yes, please go ahead.
Thank you so much. So the first question is about what are the perspectives regarding cultural practices and beliefs in the treatment and management of epilepsy?
Okay, thank you very much for that very important question. So like I mentioned during my presentation, epilepsy is deeply rooted in cultural practices in Cameroon, and I believe it's the same thing in many African countries. There are many communities in Cameroon where epilepsy is believed to be due to ancestral curses, ancestral bad luck. People believe that persons who have epilepsy can transmit it to their children, to next generation. And because of that, when somebody starts having manifestations of epilepsy, the first thing that they usually do is to go to a native doctor or a traditional healer, where they will spend sometimes all of their financial resources. And when they don't see any benefit or any cure, that's when they come to the hospital. So this perspective heavily influences how people seek care and even how healthcare workers respond to patients with epilepsy. There are still healthcare workers who also believe that epilepsy is due to maybe generational curses. So if they see a patient with epilepsy who comes to the hospital, they do everything possible to avoid. So it's a problem both at the level of the patient and both at the level of the healthcare system. So yes, cultural beliefs really influence how epilepsy is treated and how people seek care in Cameroon.
Thank you for your response. It's quite interesting to hear. And I know I've previously mentioned to you as well that I come from a South Asian country, and I know the stigma that is attached to epilepsy, and the detrimental effects that it can have on especially women, children, across all genders, and the cultural context of it. So again, to the audience, if you have heard of the cultural context in relation to epilepsy and the stigma and discrimination in your local context, please do share that in the chat box. Moving on to the next question, you mentioned what epilepsy is at the beginning of the webinar. So the next question is about how does someone know that they have epilepsy, and what is the age group that epilepsy is common in terms of the spread?
So the most common manifestations of epilepsy are actually the seizures. So most people know seizures as convulsions. There are different types of seizures, but the most common one is the one where the person actually falls, sometimes falls to the ground. Foam is coming out from their mouth. There is a ocular, like their eyes are going up, and sometimes they can urinate or excrete on themselves. This is the most common type, but there are different types of seizures. So when we say somebody has epilepsy, we actually mean that they have these recurring seizures. And these recurring seizures are not due to any reversible causes, because there are things that can actually cause somebody to have a seizure when it's not actually epilepsy. For example, if you're someone who is fond of consuming a lot of alcohol and you suddenly stop, you can develop a seizure, but it's not due to epilepsy. You can, if you're someone who has maybe a low blood sugar, hypoglycemia, you can develop a seizure which is not due to epilepsy. So when somebody has epilepsy, they have these recurring seizures, and we've done all like the basic investigations, and we cannot really find an explanation for why the person is having a seizure. That is when we say somebody has epilepsy. Now, anybody can be affected, or anybody can develop epilepsy. Epilepsy occurs at all ages, but most often it starts in childhood, and it's also common in the elderly. So anybody who has a brain, and if your brain is damaged, you can develop epilepsy. So epilepsy actually occurs because those brain cells are communicating abnormally, and anything that can damage your brain, it could be trauma, it could be infection, it could be maybe even a stroke, it could be genetic abnormalities. If anything damages your brain and upsets that communication between cells, you can actually develop epilepsy.
And as a follow-up question, is this a lifelong health concern?
Yes, quite often epilepsy is a lifelong disorder, but there are some people who I can say they are lucky, and when they start treatment, and after some years of treatment, they eventually stop having seizures. And even when you stop the medications, they will never have seizures again. There are others, when you stop the medication, the seizures, there's a relapse, and you have to put them back on medications again. So there are very few, not very few, there are some cases where epilepsy, it has this lifelong tendency. And there are other cases where after treatment, the person can stop having seizure. And even without treatment, the person can continue living a seizure-free life.
Mm, mm. That's quite interesting to know. Thank you. I'll now look at a few questions in the chat box as well. Are there any anti-epileptic drugs in Cameroon that are available for free for patients?
Regrettably, we don't have any anti-seizure medications that are available for free. But there is an organization, there's a US-based organization that has been supporting one of the clinics that we've developed in Cameroon. They have been supporting those patients with free anti-seizure medication. But currently, we don't have any donated medications from the government or other local organizations for patients with epilepsy.
That's okay. Thank you. And there's another question about I think some of the data that you presented on one of the slides. Um, the data report is based on the data is based on a 2003 report. So is there an updated version or updated data on the burden of epilepsy in Cameroon, or yeah, is there available data available in Cameroon?
Yeah, so it's true that this data is from 2003, but from my experience working with epilepsy and also conducting research, that prevalence is still as high today as it was in 2003. So I think it's even higher because their studies on epilepsy are not really frequent in Cameroon. So the few studies have come across are also reporting a high prevalence of epilepsy.
Great, thank you. And you mentioned about your organization and the amazing work that your organization does. There's a question about your organization. How large is your organization, and how many volunteers or staff members does your organization recruit?
So I have just two staff, and then I have a volunteer base of 45 volunteers presently from different backgrounds, both healthcare and non-healthcare backgrounds.
Thank you. There's a question around the prevalence of epilepsy in Cameroon. What is the prevalence of epilepsy in Cameroon
So
in general?
okay, so the prevalence actually varies. So there are studies that have reported about 1.7%. There are others that have reported prevalence as high as 5.8, which is higher than what is reported in the developed countries.
Mm. Um, all right, so I'm just going to now go back to the list of questions from the registration form. Um, in working with community health workers, in your experience, how do community health workers and other caregivers approach epilepsy treatment?
So for community health workers, when we train them, we are not really training them to become like experts. So the main objective of the training is to enable them to identify cases and refer them to local health facilities. If there is any other additional tasks they can do, it will be just to ensure counsel patient on medication adherence, counsel patient on lifestyle changes, and mostly referring cases. That is their main role.
Great, thank you. Once again, I would like to remind the audience, if you would like to share your experiences, please let me know in the chat box, and I can ask you to unmute yourself and either share your experiences or ask questions to our speaker. Do remember, this is an open discussion, so please feel free to indicate that you would like to unmute and share or ask your question. All right, coming back to the chat box, we have a question on the frequency of test that is required for epilepsy patients. How is there a regular test that can be done to follow up on patients on epilepsy?
Okay, thank you. That's a very good question. So epilepsy is a clinical diagnosis. So if I have to diagnose someone with epilepsy, I'm not going to rely on tests to tell me that this person has epilepsy. So there are specific criteria that have been developed by the International League Against Epilepsy. So if a person has 2 or more seizures occurring within an interval or separated by an interval of 24 hours, and there is no identifiable cause of those seizures, we say the person has epilepsy, or the person has a single seizure, but it's at a high risk of having another seizure, we also say the person has epilepsy. We have tests that we do to help us confirm what we already suspect clinically. For example, we have electroencephalogram, which is a test where we measure the electrical activity of the brain. Remember that I said epilepsy occurs when there is this abnormal electrical communication between cells. So we do the EEG, which is the abbreviation of electroencephalogram, to actually confirm what we suspect. Now, there are cases where we'll be forced to do brain imaging. If we have like a case where a person develops seizures after road traffic accident, we would do like a brain imaging to see if this person maybe has maybe a so maybe to see if maybe this person is bleeding in the brain, and if this bleeding is actually what is causing the seizure. Or if we have somebody, maybe an elderly person who comes with maybe one-sided paralysis and is also having a seizure, we do a brain imaging to see if this person is having a seizure because they also have a stroke. So there is no specific test that you do to like follow somebody who has epilepsy. But in the case of children, we do EEG regularly. There are certain forms of epilepsy in children where it is important to do the EEG regularly to see if actually the child is responding to treatment. And there are times when a patient can also come to the hospital and they describe something that seems to be a seizure, and you want to be sure, you can do an EEG, and the EEG can actually help you to see if this is actually a seizure. But it is also important to note that an EEG can be normal, but yet the person has epilepsy. So a normal EEG does not rule out the fact that a person has epilepsy.
Thank you so much. I think I would like to give you some break from answering questions and perhaps invite Thomas to share their experiences of epilepsy care in Guyana. Thomas, would you like to unmute and share your experiences?
Thank you, Eva, and thank you for the presentation. I just wanted to say that in Guyana, we established something we call the Epilepsy Foundation of Guyana. I was the one asking about your volunteers. You have an impressive number of volunteers. Um, we don't have that many volunteers, and we don't have staff members who are paid either. Our organization is fully volunteer driven, which presents some challenges. I think you've been really highly effective in getting out to the streets, in dealing with awareness and so forth. We've attempted, but we haven't. What we've had success with is actually introducing an EEG, the electroencephalograph. We did that in collaboration with a UK charity. I'll share the name. It's called Tele-EEG because they do work in Africa as well and around the world. This particular charity actually helps countries that have deficits in EEG services. So that's provided for free. And we also, like you, we've partnered with a US-based organization. Again, I'll mention the name. Might be the same as you. ROW Foundation. It's a social enterprise that provides us with a medication grant that we distribute for free. It's a huge benefit. Now, so I've said we've had some success. We've also had some challenges and have been less effective than you have been in some of the work you've done. But I'll conclude by saying that one thing that helped us significantly, you might not find it necessary, is that we applied to and became a member of, a full member of, the International Bureau for Epilepsy, which is one of two organizations, you know this, the other one being the International League Against Epilepsy. Now, the IBE has membership in the IBE has allowed us to partner with other organizations as well too. And you know, there are things we can do using their resources. So I thought I'll mention that. And concluding, Eva, I ought to say this, all of this happened because, well, I had been an epileptic and had been living with epilepsy in Guyana. experiencing the stigma and so forth. However, when I got to getting a Commonwealth Foundation, it was an academic fellowship. This was after my PhD. It was then I was able to have connections with and meet people in the UK who gave me guidance about what we can do in Guyana. And then when I returned, fortunately, there were people who were willing to join me. We established this organization and then had connections with the IBE. So thank you, Eva. I hope I didn't take up too much time.
Not at all, Thomas, not at all. Thank you so much for sharing your country background and also for sharing your personal journey as an epileptic. And I hope everything is all okay for you. And really wonderful to know that, through the Commonwealth Scholarship, you've been able to build that network and establish connections to take your work forward. If any of other members of the audience have anything to share, please do let us know. But Israel, I have seen your hands raised. I will come back to you, I promise. I'll just go back to Evode, if that's how you pronounce your name, to unmute and ask your question.
Yes, thank you very much. Yes, my name is Evode Kainamura. I'm a medical doctor in Rwanda, and I'm doing my master's in family medicine at the University of Edinburgh. So I would like to appreciate the presenters. This presentation is very important, and it highlights some of the challenges the patients with epilepsy, also in my country, in Rwanda, we face. So my question I would like to ask the presenter. He highlighted that he established or contributed in the designing a program of primary health care to help the people and of epilepsy. And I would like to ask if the work he has done is published so that we can access it in details, because in my country, people with epilepsy do really have challenges of accessing primary health care. And we have the community health workers, but they focus on NCDs and other infectious burden like malaria and others. But for epilepsy, it is somehow not really included. But my goals upon completing my studies, I want to work on the project about including mental health for conditions which are barrier to our community, including this epilepsy we are talking about, in the program of community health workers. So I would like to request my colleague how he has done things, how they did this project, and so that I can learn some lessons that I will based on by achieving my goals I set. Thank you.
Thank you so much, Evode. Mundih, did you get the question, or would you like me to repeat the question?
Yes, I got his question. So he said he wanted to know if we published what we've been doing.
Yes, and also your experiences of providing mental health support and leading the work with other health workers.
Okay, so for the first question, there are articles that have been written about what we've been doing. There is an article in the Guardian Post, and there is another one that was written by, I can't really remember the name, but a newspaper in Nigeria. I'll share them with you if that's okay. But for like publishing in a journal, we are still working on that. So we are currently writing a paper on that to publish what we've been doing in a journal. So from my experience working in mental health care, the first thing I would really advise you to have is to have the passion and the commitment, because it's quite challenging, especially when you are addressing an issue that many people consider as a taboo. It's difficult. When I started, I was everything in my organization. I was the leader, I was the founder, I was a volunteer. I used to juggle between clinic and the community. It's really challenging. But another thing is another thing that is important is to really be persistent, be consistent in what you're doing. When I started, I kept on educating. Gradually started joining, those said started changing. That is how we became like a voice of epilepsy in our community and in our country, and also identify people who have the same interest with you. Because when I started, I initially had some people who joined me, but many of them left because they were not really seeing the personal benefits of what we were doing. But I came across people who were really passionate about helping the community. So find people who are passionate about helping the community, who are passionate about what you're also passionate about, and also be consistent in whatever you're doing, even in the midst of challenges. Be consistent and really have the passion for what you're doing. And try to also partner with local organizations who are maybe driving change in the same area you're interested in. Work with them, train people. It's very important. Train people. You can't do everything by yourself. I'm presently in Senegal, but work is still going on in Cameroon, because before I came to Senegal, I took time to train people, train volunteers who will continue the work in my absence. So these are my advice for you.
That's brilliant. That's amazing, brilliant advice. Thank you so much. Just to let you know that I have shared Mundih's contact details, email address, and LinkedIn name in the chat box. If you would like to get in touch with her, please do. Please feel free to get in touch with her on email or LinkedIn. Mundih, if I could just request you to go to the next slide with your contact details as well. So it's there on the screen.
You are the one
Oh,
sharing.
sorry. Completely forgot about that. Great. I would like to invite Israel. Israel, did you have a question or?
Oh, thank you so much, Dr. Mundih, for the presentation. My name is Israel Balogo. I'm also a medical doctor by training, and I happen to have worked in this field for a while. My question is this, you know, the way epilepsy is, as it is with other mental health condition, which is part of what we call psychosocial disability. What is the strategy that you are putting in place for it to be sustainable beyond your intervention? Because, I mean, do you have legislation and policy that will outlive you and the work that you do? And the second thing is this: how do you get funding? You know, one of the things, the cost of medication for some of these conditions, especially in Cameroon, because I've also supported projects in Cameroon with CBM. They are very expensive, and the average rural people cannot even bear it. How do you get the government, to fit in to sustain these processes so that they will deviate and they will help reduce the cost? And finally, the other question I'd like to ask from you is this: if you're looking at the next step for your own organization, what will you suggest for everybody in different contexts like you? What would be your advice to them? You know, because of course, stigma, even here in the UK, mental health has stigma. I mean, everywhere in the world is stigmatized, you know, and disability is stigmatized. I'm a person with lived experience of disability. So what would be the next advice or best advice you would give to them? Thank you.
All right, thank you so much for those interesting questions. So for the first question about sustainability strategies that we are using, one of our main strategy is really local partnerships. When we go into communities, we don't just educate and we leave. We try to establish partnerships with community leaders, local national media outlets, journalists, school authorities. Once we establish partnership with them, it's always very easy when we want to go back to those communities to implement another project. I'll give an example. Recently, using the evidence of what we've been doing, we went to the regional delegation for secondary education in one of the regions in Cameroon. We presented the evidence of what we've been doing, and we engaged with him, and we try to advocate that what we are doing should be something that is common, or something that should be done at the level of the schools, especially as students with epilepsy are dropping out from school because of stigma and bullying. So we showed him that what we are doing actually has impact. And thanks to that, he gave us authorizations to penetrate more schools with what we've been doing. So each time we just have to go up to him to renew that partnership. So local partnership is also very important. Another example is one of the schools we visited where we were raising awareness among students. When we went there, we ensured that one of the teachers actually came and saw what we were doing. And she was so impressed that when she went back, she was the one advocating for us to the higher authorities, like, this thing that these people are doing is very important. It is very important for us to give them the opportunities. And thanks to that, we're given opportunity to come to that school every Thursday to talk to the students, not just about epilepsy, but about brain health, mental health, drug addiction. So local partnership with important stakeholders is very important. And it is very important to really start at the beginning. And I really want to make reference to my master's in global health, because I really learned from it that engaging with local stakeholders at the beginning of your project is very important. And I've been seeing the benefit of that. And when it comes to the second question, funding, it's very difficult to raise funds for epilepsy because, like I said, it's considered as low priority when it comes to government investment or even research. At the beginning, or even right now, I can say 80% of the activities that we carry out, printing out of flyers, paying transportation for local volunteers, is from my personal savings. And this also boils down to what I said earlier. You need to have passion for what you're doing. If you're passionate about something, then you'll be willing to make the sacrifices to achieve that thing, even in the midst of challenges. It has been difficult because we approach like government agencies, we present to them what we are doing. Some of them don't even read our reports. They don't even reply. We never hear back from them again. If we keep on depending on them, we wouldn't have done all the things that we've been doing. So at one point, I just decided I can't continue to wait and wait on the government. I need to start doing something. And I decided to dedicate a small portion of my monthly earnings to print out flyers, to support volunteers with transport fares, and to even sometimes we even purchase those didactic materials with our own resources. And we also have goodwill individuals who see what we are doing and they support our work from time to time. And like I mentioned, we have this organization in the US that has been supporting our clinic with donated medications. And we have other organizations that have been supporting us with small grants to organize awareness raising activities. And for the next step, so what we are trying to do now is to really engage in policy making, engage with policymakers, to ensure that we design and we implement an effective policy, not just for epilepsy, but other brain related disorders. Thank you.
Thank you so much. And I think it was great to learn more hear about how your scholarship and your master's course helped in understanding how to leverage partnerships. So thank you for sharing that. Very quickly, just concerned about the time, very quickly, Joyce, I would like to invite you to unmute and ask your question.
Oh, thank you, Eva. I'm Joyce from Cameroon. I just want to share an experience and thank Mundih Njohjam for the presentation. I had a sister who had epilepsy back in those days, back in the 90s, and it was a whole taboo. It was a whole taboo to live with somebody who had epilepsy. She went to school, she had attacks in school, and she really experienced stigma. And in consultation with the school authority, they said it was better she dropped. So she dropped out of school due to her health condition. And it had serious impact in the life of her family because not everybody was seeing her normal. Even when she wants to interact in the community, it was really a problem. So I really want to appreciate the work that is being done by Mundih Njohjam and her organization to sensitize students, to sensitize the communities on epilepsy. I think with such a knowledge, such knowledge on epilepsy is going to reduce the stigma that these patients face in the community. Thank you.
I think you need to unmute.
You think you'd get used to it, but clearly not. Thank you, Thomas. I think with this, I am aware that I may have missed a few questions in the chat box, but I'm just concerned about time. So I will have to, unfortunately, end the Q&A session here. But as I've said, please feel free to connect with Mundih on either via email or LinkedIn. She'll be more than happy to connect with you and share details of her work, or if you would like to ask her any queries that you might have about her work, please feel free to get in touch. Mundih, I would like to now invite you to just quickly summarize and share a few final words before we end the webinar.
Thank you so much, Eva. Thank you, everyone, for the interesting discussions that we've had. Thank you for your questions. And my take-home message would be that know that epilepsy is treatable. It's not a contagious disease. And whether we are affected by epilepsy or not, we all need to join hands, join our voices to really raise awareness, because despite being one of the oldest known diseases, epilepsy is still surrounded by a lot of myths and misconceptions, and those affected are really suffering. So it will take collective efforts to effectively and sustainably address this issue, and your voice and your actions matter. Thank you very much, and I'm also grateful to the Commonwealth Development in Action organizers for this wonderful opportunity.